I have two grandchildren that are basically victims of substance abuse. And one of them was not born addicted, and the other one was. And I have been through a lot of difficulties because of it. The children suffer because of it. The baby was born with severe tremors and had to be watched for several days in the hospital. I had tried to get DCF involved during my daughter's pregnancy, and they would not intervene. My daughter was on probation. I also tried to get the probation officers to intervene, and they would test her, but my daughter has years of knowing how to get around their tests, so she wouldn't come up positive. And so when she went to the doctor for her last visit, I went with her, and I told the doctor that I had already called their office some weeks previously. She claimed she had never gotten the message, and they went ahead and induced labor because my daughter was in preeclampsia, toxemia, and so they went ahead and induced labor. And when the baby was born, they did testing, and they also could tell by symptoms. She had tremors, and there were other things that they looked for. And so she was there for several days, and then on the day that she was supposed to come home, where my daughter thought she would be coming home with her, Child Protective Services came out and actually asked me if I was interested in taking the baby. Otherwise she was going directly into foster care because she was going to be released from the hospital. When Child Protective Services asked if we would take on the baby, my first thought is, of course, it's my grandchild. What else can you do? And at the same time, I was already raising another grandchild due to substance abuse issues, and it's very overwhelming, it's very daunting. You've done your job as a parent and raised your own children, and thinking of taking on not just one now you're taking on a second one. And so it's very overwhelming. And I was literally, she was in there 6 days, and I was actually not told anything in the meantime that this was going to happen. It was at the 11th hour, when my daughter thought that she was bringing the child home, that she ended up coming home with me. Right now, she's 18 months old, and she's an amazing, amazing baby. Very smart. She's really amazing. At a month of age, when her mom was sent into a residential treatment facility without her, the baby stopped eating. Okay, 1 month of age. People don't understand that. And I had the godsend of Dr. Harleen Hutchinson, who really educated me on early childhood development, and then the parenting person who was working with it, had started working with the baby, convinced the treatment facility to allow me to bring her over there to continue bonding with her mother. So, because I actually ended up having to take the baby to the hospital after 3 days of her just dwindling down on eating, and it was absolute, and the doctors really didn't want to hear it, but at the same time, one of the pediatricians did say that's very interesting, because it was more than coincidence that at 1 month of age this child would just stop eating. So, and then she was able to see mom often enough, because they did make that exception. She was able to see mom often enough that she really had a very good bond with her. So a few weeks later, when she was allowed to go with mom, she did very well, and apparently adjusted very well to that change. I know when she was recently put in my custody again due to a relapse, when she was put in my custody again, she seemed to cry more easily. She's a very good baby, but she seemed to cry more easily, and just be maybe a little bit depressed, and just not quite herself. And she has adjusted to being back here, but when she's around mom, she wants mom more than anybody. She had a response to she had an autoimmune response to a virus a few months ago, where she got a virus and she kept getting hives. And as far as I know, this is not related to substance abuse. Okay, and it's lasted for months, and it's just dwindling down now, and it kind of had a domino effect. She has not been able to stay in daycare because of being chronically ill, and she goes to daycare. After a couple days she gets sick, and she's back home with me. So I haven't been able to work because of it. I've had to stay home with her. She does. Right now, she's coming to the end of just having this domino effect over the last few months, with starting with one thing and just seeming to go into other things. She's doing very well right now. My daughter does understand what's at stake here. For both children, the default setting, the older one is permanently with me. The younger one is temporarily with me. And the default setting, default placement for the child can be with the other parent, as long as they're not a substance abuser or they don't have a background that would not lend to that. So not only does she understand that she can lose custody of her child permanently, she can also lose the permanent guardianship, just as I have with the older one. And I think she also understands the effect that if the younger child is removed for whatever reason, that the older one would be very traumatized. There's been a lot of abandonment issues, and she would be very traumatized. And the baby, she has the things that she was born with that lasted very, very, very long time, the tremors. When she gets sick, they still come back. We don't want to put stress on the baby, we don't, and so my daughter does understand the implications. She's been clean now for several months. She's going through a program that's ordered through probation, and she's also going through something through ChildNet and DCF. So she does understand this is her last opportunity.
That is a heartbreaking story on so many levels, and I have to thank Mrs. Putt for sharing so openly the struggle that she and her family have had. I know many people may be wondering, why would DCF not have taken the child away at birth when all of those issues were presented? Linda, you had some thoughts on that.
Yes, generally when the drug that is abused by the mom during pregnancy is an illicit drug, automatically DCF will be called in. And then they'll evaluate what's going on with that particular case. They'll see if there's a family placement that's the most appropriate for the child, because obviously the goal is not to remove the child from the extended family if at all possible. But sometimes they do have to remove and place the child in foster care. And that definitely does happen with illicit drugs, but with prescription drugs, that's not an illegal drug. That mom has a prescription. Now, if they could determine that the mom had been abusing prescription drugs and determine that she's been obtaining them illegally, that might be different. But a prescription drug is not an illegal substance, and so DCF doesn't remove these children. And oftentimes services aren't even put in place. The child just, majority of the time, probably 89% of the time, the child just goes home with the parents.
And that's a tricky one because nothing was showing. And the Children's Services Council has a very large investment in family strengthening programs where we know there's an issue and we know that services can be helpful. We also do fund a kinship program, which we're connecting Mrs. Putt with to make sure that she's getting some supports that do exist for those kinship families. But if we don't know that there's an issue, it's hard to intervene.
Absolutely.
We also heard Mrs. Putt talk about, the father in all of this. So Sam, I want to bring you back in to sort of talk about that role of the father.
Yes, as I said earlier, when I meet with the fathers, I just try to explain and let them know the importance of their role as the father to that mother. And as we heard Mrs. Putt say, as she's saying she had her kids already, and now she has 2 more kids, and it's a lot of stress on her, and she has to miss work. So these are the type of things that I talk to the father about, because he can be there to strengthen that family, take some of the stress off of the grandmother, and support the mother. You'll never know what happened when she gets that little bit of love that she may need. She may just turn all the way around. And another thing that Mrs. Putt touched on is that when the father is able, he has to be able, as in saying, okay, if DCF is not going to take the children and give them to you, you have to be clean yourself as well and able to pass the drug test as well. So.
Right. Now, Susan B. Anthony, I mean, I'm sure you see a lot of these cases of the women who, you know, recover for a little while, are back again. It's a bit of a cycle. How do you help them?
And it's interesting because the majority of these children do end up with the grandparents. Maybe like 10 of my cases that I was working with were children living with their grandparents until now. When I go out in the community, I go to the grandparents' homes, and the story is the same, you know, just like Mrs. Putt was identifying and saying, like, these are women who did their job, raised their children, and they didn't think that they would be thrown back into it once again. And they have mentioned numerous times, you know, that if fathers were able to provide them with a little bit of support, you know, things may be very different, you know, because they're trying, you know, to get their daughters where they are and to different programs. You know, there's one mom that was talking about how many different programs she got her daughter in and out, you know, with the children, you know, keeping her at her house. There are grandparents that kept their own daughters like in the backyard just so they're not close to their children. They've taken drastic measures, you know, to help them. And
Linda, the doctors, are we doing something or to help show the moms what the effect is of the drug use on their babies, even if they don't care enough about themselves or if the drugs have such a hold? Is there some way to appeal to the impact on their child that has been effective? Do you know anything about that?
Well, you know, it's a very well known now that, you know, that there's been a prescription drug abuse problem in addition to alcohol and illicit drugs. And, you know, the obstetricians are always sharing that information in their offices. And you also have all the community agencies that are sharing that type of education with the moms when they engage them for services. For instance, Healthy Start, Healthy Families, our programs at Family Central, all our family strengthening programs that you mentioned, our fatherhood programs. All of those programs, you know, those are things that we discuss with the mom, you know, the risks that she's taking during that pregnancy. And now some of the moms, you know, their addiction may be so strong that, you know, they may understand what you're saying, but they may not be capable of doing anything about that. And then you have some moms that actually are asking for services and they'll have to be detoxed during the pregnancy. And when they're detoxed, they're not, as I said before, they're not taken off of everything. They're just put on generally methadone. So that baby's still going to be born substance exposed. The baby's still going to require treatment. It is treatable, but as we said before, we don't know what the long-term complications are. But it is 100% preventable if we can educate the community that, you know, before you get pregnant, you need to really consider these things. But
So
a lot of women
that's a
don't.
place that we have to stop. If you are a woman of childbearing age, or you know a woman of childbearing age, please, please be careful of your use of prescription drugs, alcohol. We know you have issues, but you've got to think about that potential child and the consequences to them and to your family. I want to thank Linda Welp, Toula Zoulas, Sam Brown for their expertise, and Melodee Putt for sharing her experience and giving a human dimension to the issue of substance-exposed babies. I've been your host, Cindy Ehrenberg-Seltzer, President and CEO of the Children's Services Council of Broward County, where our mission is to empower Broward's children to become responsible, productive adults capable of realizing their full potential, their hopes, and their dreams. For copies of this program or any other episode of Future First, please call the Children's Services Council at 954-377-1000 or visit www.cscbroward.org. I hope you'll like us on Facebook, and remember to join us next time on Future First, Focus on Broward's Children.